Hello, I'm Bill Ager, certified yoga teacher, and I'm just about a little over a week post total hip replacement. I had my right hip done at Health One Orthopedic with Dr. Mark Tuttle, and I'm doing some recovery exercises to help with my recovery. So hopefully some of these may be useful for you. You can always consult with your surgeon and a physical therapist, make sure these exercises are right for you, and never ever do anything that causes any pain. So I'm still using my walker. My walker's here, and I use it if I need stability for any of the exercises. And what I'm going to do is start doing some upper body exercise. The reason I do upper body exercises is because for me I found that the hip surgery has caused some soreness in my lower back. Okay? So I'm going to start with a very simple exercise where I take my hands, bring them up to my chest, raise them up overhead, and just start to pull back a little bit, opening up my chest, feeling that in my lower back. Breathing in deeply, breathing out deeply. Then what I do is I take my right hand with my left hand and I bend over towards my left. Now, since I had my right hip done, I notice this all the way down my side through my hip. If I want to extend this pose a little bit deeper, I can look down towards the floor. Then I go back to the side, and then I extend it up by looking up to the ceiling a little bit. Okay? Now what we find out in yoga, of course, is if we do one side, we need to do the other. So I will now grab my left hand and move over towards my right. Bending towards my right, I feel the stretch all the way down the left side of my body. I look down to the floor. I look to the side. And I look up at the ceiling. Now I'd recommend holding for a count of 3 to 5, whatever feels comfortable. You want to hold long enough that you feel the stretch. Releasing my hands. Now there's a couple of other things I can do for my upper body that will help my lower body. One thing I can do is I can actually use my walker, putting it right in front of me, and I'll just stretch forward using the walker, stretching forward, and I can feel that in my lower back as well. I can do a series of repetitions on this, breathing in as I come out, breathing out as I go down. 2. And I recommend everything in slow motion. Do things in slow motion and you'll get more benefit from the pose. This is not a race. If you're in recovery from hip surgery, you'll know very quickly that there is no race going on. You want to take things very, very slowly and recover. Usually when I do repetitions, I like to do a repetition somewhere between a count of 5 and 12. It kind of depends on where you are. First couple of days post-surgery, I was doing about 5. Then about a week out, I'm doing 10 to 12 on things. Okay? Another thing you can do, in yoga, it's called Guardasana. You take your right hand, you put it under your left like this. And then what you do is you take your forehead and you just move down towards your hands like this. You'll feel this all the way through the upper back, the shoulders. Breathe in deeply, breathe out. Once you finish that, you're going to want to do the other side. Bring your left hand under your right. Try to bring your shoulders so they're just up about at the same level as your elbows. And have a straight line across there. Breathe in, breathe out, and release. A couple other simple things you can do from a standing pose. You can do some very simple bear swings like this. Rotate your upper body. As we move down towards our hip a little bit, one thing that I like to do is I like to grab either side of my hips and do some simple circular motions, almost like I'm doing a hula hoop. First I do it to the right. Usually a count of 10, 5, 6, 7, 8, 9, 10, and then of course the other direction. Whatever we do, we need to do to both sides of our body and both directions. Otherwise we can create tension and soreness even in the other side of our body. While we're working on the right side, in my case, if you're working on the side where you obviously have the hip replacement, but the other side of your body needs attention too, so you're always evening things out. Now I'm going to move to some exercise where I work on my lower part of my body. This is going to be my hip area and below. So these exercises are going to focus on the lower part of my body. And I'll actually start with some exercise where I'm simply using my feet to raise up and down. And while I'm doing this, I'm actually holding on to the walker. Now, if you feel comfortable without holding on, that's fine too. I like to have a little extra stability. What this raising and lowering does, raising on my toes and lowering down, is it actually strengthens my my calves, my lower calves on both sides. This is also good to keep the blood flowing in our legs. We want to prevent blood clots. So moving after the surgery is very important for preventing blood clots. Another thing you can do is you can stand up on your good foot and take your bad leg, or the leg that's actually recovering, and start doing some small circles with it. So I'm doing some small circles. You can do the circles in the front. You can do the circles on the side of your body. You can do the circles behind. And I'd recommend doing these for whatever's comfortable, somewhere between 10 seconds to 20 seconds each. Another thing you can do is just do one large circle. You'll feel this probably not only in your hip, but all the way down your leg. Okay? When you're done with that, I'm going to start testing my ability to raise my leg that had the surgery. Raising it up and down, up and down, up and down. If I want to be a little more adventurous, I can raise it up and see if I can kick out as far as I can go, back and down. Make sure you do that in those stages: up, out, back, down. Up, out, back, and down. Okay, fantastic. So these are some simple standing exercises that you can do to get blood flowing and get stretches going through your whole body. Now what we're going to do is move over and do some exercises laying down. Now I'm laying down in bed, and I'm going to be doing some bed exercises. These are fantastic because you can do these literally the day after surgery if you're comfortable with that. The first exercises don't really have a lot of movement in them, so I will describe what they are and just do a couple of reps, but then you can do more on your own. So the first exercise is laying very comfortably. You breathe in, you breathe out, and as you breathe out, you start to tense the muscles of your upper thighs, okay? So you're tensing your muscles, and I like to hold for a count of 5. Breathe in, breathe out, tense those muscles. 2, 3, 4, 5, and release. And those are the muscles that are right in here. Second time, tense. 2, 3, 4, 5. Release. Third time, 2, 3, 4, 5, release. Fourth time, 2, 3, 4, 5, and release. Fifth time, 2, 3, 4, 5, and release. So we'll just do 5 for the demonstration, but I recommend you can do up to 12 if you're comfortable with it. The second one is similar, where I'm just tensing the muscles underneath my bottoms, the gluteus maximus muscles that are right underneath your butt. You tense those on the other side, okay? So same thing. Breathe in, breathe out, tense those muscles. 2, 3, 4, 5, release. I like using my hands to keep track. 2, 3, 4, 5, release. 2, 3, 4, 5, and release. 2, 3, 4, 5, release. And 2, 3, 4, 5, and release. Okay? And you definitely feel that all the way through the area that you've had your surgery. Okay? Next exercise is you take the leg that you've had the total hip replacement done on, bend your leg up, be comfortable, and slowly, as you're breathing out, Move your leg down towards the other foot, and just about here, when you still have a good bend, you push your heel into the bed, okay? Pushing your heel into the bed, you'll feel this tension and muscle exercise all the way through your whole leg, okay? Hold that for a count of 5 and release. Let's do a few more of those. Bring it up, out, heel down, 2, 3, 4, and 5. Release. Bring your heel back up, down, push the heel, 2, 3, 4, and 5. Release. Third time, fourth time, push out, 2, 3, 4, and 5. Release. Push, heel down, 2, 3, 4, and 5. And release. Again, if you can do more reps, that's great. You can also take a break between reps and do a second or third sets. Now I'm taking this rolled up blanket and putting it just under my thighs here on the bed, okay? I'm going to lay down. There's a couple of exercises I can do in this position. One thing that I can do is I can take the hip that's had this surgery, and I can simply move it from the right to the left, left to right. So I'm just expanding that hip out and bringing it back towards the other leg. Again, out and back in. Out. Again, there's no rush on these exercises. You do it at your own speed. In fact, the slower you go, probably the more benefit and the more working of the muscles you'll feel. And one more. Now, what I find to be a little bit more difficult using the same blanket for this exercise is taking my leg and taking the leg that's had the surgery and simply lifting the leg up, okay? Now, I'll show you what I can do with my good leg, the leg that hasn't had the surgery. I can lift it straight up towards the ceiling. Now, that's not quite true yet of the leg that's had the surgery. I can lift it up, but only about 3 inches and hold it for a count of, I would say about, for me, 4 is a good count, and back down. Up, hold 2, 3, 4, and down. Up, 2, 3, 4, and down. Up, 2, 3, 4, and down. Up, 2, 3, 4, and down. Okay, fantastic. Now I'm going to take that blanket out. And I'm going to do a couple of exercises that simulate what you can do in the gym with the abduction and adduction exercise, where you're moving your hips in and out, okay? The first one uses simply some pillows. So again, I bend my legs up, put 2 pillows between my thighs and my legs, okay? Now this exercise takes a little bit more coordination to do it properly. So as I breathe out, I tense the muscles of my lower stomach, so I have a firm back. I don't want to do anything that hurts my back. Breathe out, hold those muscles, and then I move my hips up into the air, okay? And as I do that, at the same time, I squeeze my legs together for a count of 5. 2, 3, 4, and 5. Back down to the bed. Breathe out. Relax for a second. Breathe in. Breathe out, hold your stomach muscles, raise your hips, squeeze the pillows, 2, 3, 4, and 5. Slowly back down. Keep breathing the whole time you do this. Breathing is very important. We don't want to stop breathing. And again, out, hold the stomach muscles, hips go up, squeeze the pillows, 2, 3, 4, and 5. And back down. We're up 4, breathe out, hold my stomach muscles, raise my hips, squeeze the pillows, 2, 3, 4, and 5. Back down. And last rep in this set. Again, you can do as many as you want. I'm at the point now, a little after a week, I'm doing about 12. 2, 3, 4, 5. And you find out that less is better. It's better to do what you're comfortable with just to get to your edge, and then wait maybe 4 or 5 hours and do a second set if you're ready for it. Don't ever do too much during one set. Now the opposite of this exercise is an exercise where you're going to bring your hips out. And I like to use a band doing this. So let's put a band on my legs here. Now for this, if you need a band, you're going to need to have someone help you do this. I find it's very difficult to put these bands on by yourself. But they're fantastic. The bands really allow you to do a lot of different exercises. So I get the bands put just above my knees on either leg. Okay. And you'll find out that these stretching bands come in different levels of intensity, how tough they are. And I'm using one that's kind of middle grade now. You'll see how far out it goes. So the rest of the exercise is the same. You breathe out, you tighten your tummy muscles, you raise your hips up off the bed, and you go out. Count to 5. 2, 3, 4, and 5. Bring them back in and lower back down. Second set. Breathe out, hold your tummy muscles, hips up, move out. 2, 3, 4, and 5. Back in and back down. Number 3, out, hold my muscles, hips up. 2, 3, 4, and 5. Hips back together. Number 4, 2, 3, 4, and 5. Hips back in. And number 5, 2, 3, 4, and 5. You find that by doing a variety of different exercises, you use all the muscles in your upper body and lower body. So it really provides a full body workout, which is what we want. We don't want to focus just on one area of the body. Okay. Now we'll show you something you can do that you definitely need some assistance with, but I find that it really helps loosen up the leg, and that's by having someone come over and work your leg in a couple of different ways. The first way is by having them hold the bottom part of your foot and simply lift your foot up and rotate it around a couple of times. So let's see how that goes. Gently the person grabs underneath your foot and rotates. I don't think it really matters which direction you go. For me, it feels better when we work clockwise like this. You can see it's moving all the muscles in that leg all the way up through the hip joint. And we can go the other way a little bit. Okay, so these are a combination of full body standing exercises as well as bed exercises. I might have some more in the future for you, but these are a few to get you started in post-recovery. It's very important to do things in the 2 weeks, the 4 weeks right after surgery to have a better recovery. We all want to recover as quickly as possible from total hip replacement so we can enjoy that new hip and get out and do the things that we've always loved in life. So we'll see you soon. Thank you.